Ashley. My name is Michelle, and I'll be your nurse today, and I'm going to do your health assessment.
Okay.
All right, first we're going to take your vital signs and then ask you some questions.
Okay.
Ashley, can you tell me your name, full name, and birth date?
It's Nicole Ashley Smith, 4/15/85.
Okay. Having any pain?
Nope.
Okay.
0.
All right. Any allergies?
Not that I know of.
Perfect. All right. Get your blood pressure. I'm going to listen to you. Okay, and let's see. Temperature is 98.1, heart rate is 85, and your blood pressure is 118/83. Your
Is that good?
looks great.
Okay.
All right. So, been feeling okay?
Mhm.
All right. Check your capri. Oh, you got your fingernails done. So, since her fingernails are painted black, to get her cap refill, I have to do to the tips of her finger. It's less than 3 seconds, so they look great. Alright. Skin turgor is good. There's no tinting, no edema. Skin is not warm, and it's nice, good color, pink. All right. Ashley, can you tell me what today's date is?
November 12th.
Can you tell me where you are?
I am technically at St. Mary's Hospital, but I'm in the pediatric OPIC.
Oh, right. Okay. Do you know what time it is?
It is 8:55.
Okay, so you're alert and oriented. That's great. Vision. Any problems with blurry vision, seeing spots?
No, I had LASIK.
Okay, great. So you don't wear glasses or contacts, even for reading. You don't wear glasses. Okay. Now, I don't have a Snellen chart, but if I did, I would ask Ashley to cover one eye and read down the chart to tell me which is the lowest line that she can read with clear vision, and then get her to cover up the other eye and do the same thing. And I don't have a flashlight, but if I had a flashlight, I would cut it on and off and look at her pupils and go from side to side, making sure her pupils are equal and reactive to light. Ashley, can you smile for me? Now make a mean face. Perfect. Okay. And her facial symmetry is good. Her ears are even. Eyes are even. Mouth. Hearing. Any problems hearing?
No.
You wear hearing aids.
No.
Okay. Good. Can you stick out your tongue? Can you raise it up and try to touch your nose? Okay, so you have a short tongue. Can you turn your neck side to side? Okay, perfect. Can you shrug your shoulders? Perfect, okay. Now, stick your hands out. All right, now I want you to try to raise your hand, push your hands up against mine. Perfect. Now, I'm going to push them down, but don't let me push them down. Good. All right, now can you stick your legs out for me? And we're going to do the same thing. Can you pull your toes towards you? Great, you're strong. Okay, now push against me. Oh, goodness, okay. Now, if she didn't have her shoes on, I would check her cap refill of her toes as well. And I would check her pulses on the tops of her feet, on the sides of her ankle, and then back behind her knees. For cardiac, I'm going to listen to her heart and at her aortic, pulmonic, Erb's point, tricuspid, and mitral. Heart sounds fabulous. Now, can you lean back a little bit?
Yeah.
Thank you. Perfect. Okay. So now we're going to try to palpate Ashley's arteries. So we're going to do her radial. And then her brachial. And I'm not going to actually do it on Ashley, but then I would palpate her femoral artery, which is right in here. And again, during my physical exam, I'm going to be palpating to see the temperature of all of Ashley's extremities, making sure she's not like hot or cold in one area versus the other. Ashley, any history of heart disease or strokes or heart attacks, hypertension in your family?
Oh, my dad.
Okay.
All of the above.
Okay.
No stroke.
Oh, okay. All right. So now it's time to assess Ashley's respiratory system. So we're going to look, while I've been asking her these questions and doing the other part of my assessment, I'm going to be watching Ashley breathe and making sure she's not working hard to breathe. Going to look at the rate that her respirations are, the depth of her breathing, and then I'm going to listen to her lungs, both anterior and posteriorly. All right, can you take a deep breath? Good job. And I'm going to go side to side, assessing each side. And while I'm listening, I'm going to be looking and listening for any abnormal breath sounds, which Ashley does not have. She sounds perfectly clear. Ashley, any history of a pulmonary embolism in your family?
No.
Okay. Or asthma?
No.
Okay. Perfect. Okay, and now we're going to assess Ashley's GI system. So if you will lean back for me. All right, I'm going to listen to her belly and all 4 quadrants. Make sure I hear vowel sounds, which I do. And if you didn't, you would have to listen in each quadrant for 5 minutes. And then I'm going to palpate Ashley's belly. I would first do a lightly palpation, and then I would do a deep palpation in all 4 quadrants. Ashley, any problems with diarrhea, constipation, bloody stools, nausea, vomiting?
No.
Okay. So at this point, I would talk to Ashley about my findings of her health assessment, which everything looks great. She's not complaining of any pain anywhere. Respiratory, she sounds great. And I would, for her, I would say for an appropriate clinical prevention, making sure you're doing your exercising, taking time out for yourself. You need to take care of yourself. If you don't take care of yourself, you can't take care of other people. And any questions, Ashley? Any other problems that you're experiencing?
No, that's a great assessment.
Well, thank you so much.